Hi, Dr. Pryor here at Breast Implant Illness Centers of Excellence in Palm Beach. So I just wanted to clarify some of the nomenclature and questions regarding what is called an actual, what do we do here, right? So you hear all the time on social media what's commonly referred to as an en bloc capsulectomy, and what exactly is that and how is that different from a total precision capsulectomy, which is a new terminology that I just learned about, a total capsulectomy, a partial capsulectomy. So, generally the term en bloc comes from oncologic or cancer surgery, and that's used to basically mean that we're taking out all of the cancer, usually with a rim of normal tissue, to make sure that you've totally resected the cancer as a single specimen without actually getting into the cancer, without cutting through it, without having it contaminate the other parts of the anatomic field. So it is a cancer term that has been applied to explant surgery, and it's very commonly used now on social media and even by very experienced plastic surgeons, as this is an en bloc surgery, meaning obviously it's not related to cancer most of the time, but we're taking out the implant and the capsule altogether. So an en bloc capsulectomy, if we use the language loosely, is the same as a total capsulectomy, meaning that all of the capsules coming out, total meaning all of it's being removed, but in an en bloc fashion, which means that it's all coming out with the implant intact and all of the capsule around it. Now, you could also do a total capsulectomy by, for example, making an incision, taking the implant out, and then removing all the capsule on the back end. So in my opinion, that would not be considered an en bloc capsulectomy, or what they're now calling a total precision capsulectomy, because it's not coming out as a single unit. So I think that's a lot of the misconception that I hear about is total capsulectomy versus en bloc capsulectomy. Now, apparently there's a new definition that makes it even more confusing, I think because of the oncologic or cancer-related meaning behind en bloc. The societies are trying to get away from using that term when we're not talking about a cancer surgery. So the recommendation is not to use the term en bloc. Obviously, anybody that's not a physician or a surgeon, it doesn't matter. But from a professional society standpoint, they want to use the term en bloc specifically for oncologic surgery, and then a term called total precision capsulectomy for basically what the en bloc is, which is taking out the implant and capsule together as a single unit. Again, still different than a total capsulectomy, which does not mean that the implant and capsule are coming out together. They can be coming out separately. That's okay, keep going. This happens all the time. This is real.
Taken out separately. Start there.
So when you do total capsulectomy, they can be been taken out separately. The implant can come out first and the capsule can come out second. That's different than a total precision capsulectomy, where they all come out together in a quote unquote en bloc fashion, except that we're not doing it for the purposes of cancer surgery. Now, it makes it even more confusing because in explant surgery or in patients with breast implant illness, especially patients with textured implants where there's concern about the notorious ALCL, anaplastic large cell lymphoma, which is not a breast cancer. It's actually a lymphoma that forms in the capsule around the breast implants from the inflammation caused by the texturing on the implants. That's technically a oncologic surgery. And so for surgeons that are taking out the implant and the capsule in a total precision fashion for the purposes of making a diagnosis of ALCL, I think it would probably be appropriate to call this an en bloc surgery, because there is a cancer meaning behind there is a cancer meaning behind the actual surgical process. Let me do that part again. There's actually an oncological indication behind the surgical procedure. So all that being said, trying to simplify it, en bloc capsulectomy, in my opinion, technically, other than maybe you're taking out a little bit more natural tissue with an en bloc to make sure that you're not leaving any cancer behind, is basically the same thing as a total precision capsulectomy, en bloc capsulectomy. We're taking out the implant and the capsule altogether. That's the important part. Leah's giving me the hurry up.
Only for 5 minutes, yes.
Okay. And that's different from either a total capsulectomy or a partial capsulectomy. Total capsulectomy, all the capsules coming out. but not necessarily with the implant on the inside like it would in an en bloc or total precision capsulectomy. And partial capsulectomy is used for other purposes. Probably shouldn't even be something that we're doing in breast implant illness and explant surgery, but that basically means that pieces of the capsule are coming out. You're definitely leaving some of the capsule behind, and that's used in different types of breast reconstruction. So did I make it simple enough?
Yes, and I do have a question. The American Society of Plastic Surgery is talking about total intact capsulectomy. Can you confirm that that is what you are talking about, the total precision capsulectomy?